Johnson Okenye. Now, an alarming number of people in sub-Saharan Africa may be taking cancer drugs that don't contain vital ingredients required to fight the disease. This shocking revelation comes amid the growing need for cancer drugs in the region that faces a significant burden of the disease. Nearly 20% of all cancer drugs in 4 African countries, including Kenya, are said to be counterfeit or substandard. On this episode of Health Digest, Gloria Milimu interrogates why it's important for cancer medications to contain the right amount of active ingredients in order to ensure that patients get the correct dose.
Kenya is confronted with a growing burden of cancer cases, which in turn creates the need for quality and effective anti-cancer medications in order to ensure good patient outcomes. These medications are crucial for treating and managing the disease, as they destroy or slow the growth of cancer cells, preventing recurrence or alleviating symptoms. However, the exponential growth of cancer cases has exposed huge holes in the global safety nets intended to protect patients from substandard drugs. These loopholes have now left cancer patients in at least 4 African countries at risk of ineffective treatments and potentially fatal side effects, according to a research published in the medical journal Lancet Global Health. Researchers from the University of Notre Dame in USA found that at least 1 in 6 cancer medications in Kenya, Ethiopia, Malawi, and Cameroon contained incorrect vital ingredients required to treat cancer. They analyzed at least 251 samples of chemotherapy drugs in dosage forms from 12 hospitals and 25 private or community pharmacies in the 4 countries. And the results were horrendous. Cancer patients in these countries were literally being shortchanged as they received poor quality drugs whose effects could be devastating. Dr. Gladwell Kiarie is a medical oncologist and the current president of Kenya Society of Hematologists and Oncologists. She helps us put to perspective the magnitude of these findings.
We've always hypothesized that the poor outcome of patients in low to middle income countries is because of the late presentation. But now we have to be cognizant to the fact that also the poor quality of treatment methods and drugs in this particular case may also be a reason why we have poor outcomes in our patients. Now, they analyzed the post-expiry active pharmaceutical ingredients in those that were expired and found they had 17% active ingredient. But when they looked at the pre-expiry drugs, they found that 20% of active pharmaceutical ingredient existed in those that were being actively used.
Some of the drugs analyzed contained incorrect quality of the key ingredients, also known as the active pharmaceutical ingredient. This is the core component of a medication that produces its intended therapeutic effect. Some of the drugs contained too little of this ingredient that giving them to patients would be as good as doing nothing.
Now, when the potency is low, it means sometimes we are giving a volume or an amount of drug that will not do anything to the cancer disease. We are also giving an amount of drug that may give profound side effects to the patient with very minimal benefit.
The active ingredient in chemotherapy drugs, which fights cancer cells, is also said to be highly toxic. Dr. Kiarie warns that patients should just receive enough of it to treat the cancer and not so much of it that they suffer adverse effects.
The administration should be done by qualified individuals who are well trained, and also should be given in the correct environment, and also should be given at the correct doses, because these drugs can kill patients acutely or can even kill patients based on the side effects.
In their study, the researchers highlighted how a combination of factors, including low capacity for regulatory oversight in a market, is fueling the infiltration of counterfeit and substandard anti-cancer medications in the 4 countries. They include faults in the manufacturing process or product decay due to poor storage conditions, among others.
Even when these vulnerable patients buy poor potency drugs, the transport of the drug is breaking the cold chain, is affecting the movement and the shaking of the drug, the exposure to light, and sometimes even if they were 20% on the shelf, by the time they get to being administered to the patient, they are probably close to less than 10%.
The oncologist, who says a bigger analysis of the extent of the problem is supposed to be conducted, proposes several strategies to help tackle poor quality cancer medications in Kenya.
We need to empower National Quality Control, government agency, and DURA to be able to have the muscle to actually carry out monitoring and inspection countrywide. And we also need to create awareness to patients and to the professionals in our bodies that they can actually do individual reporting.
Kenya reports at least 50,000 new cancer cases annually. 60 to 70% of these patients, according to Dr. Kiarie, presents with the late stages of the disease, which is expensive to diagnose, stage, and even treat. Gloria Milimu, KTN.